this is Samuel Collins, your coding and billing expert for acupuncture in the American Acupuncture Council Insurance Information Network and Seminars. Welcoming you to another episode of To The Point. Today's program, we're going to focus a little bit on what's upcoming shortly for changes to the VA program, as well as how to code properly for cupping and Moxibustion. We're beginning to notice some carriers are beginning to pay, so we want to make sure there's a good understanding of what are the best codes to use and how to code for them. So let's go to the slides. Let's take a look at what we need to go or what we need to know about upcoming to the VA program. So the VA program, as you're well aware, is likely due mostly to the fact of the national overdose death rates. And this is really quite an interesting stat. If you notice, we now have 70,000 deaths a year attributed to opioid overdoses, whereas just 1999 was less than 20,000. So this clearly is an epidemic, and the real reason probably behind why acupuncture is being accepted, because they have to look at something different, a new way of approaching dealing with pain. And of course, we all know acupuncture is very helpful. In fact, let me show you something. I put a link here, but let me show you this article from the LA Times. And it noted that oral surgery is tied to opioid abuse risk. So now think of patients or parents of patients who have a child going for a tooth extraction. They, of course, are often given narcotics. Here's something interesting. Just that one-time use of narcotics after a tooth extraction has led to 6% of patients having an encounter at an emergency room for opioid abuse. Therefore, they're finding a correlation here of likely the opioids even used just these few times. So certainly something you may want to talk to a dentist in your area that does oral surgery and see whether or not they're interested in maybe having you come in 1 or 2 days a week to help deal with pain management and swelling post-surgery as an alternative to the narcotics, because this is a heck of a thing. So I'll tell you, take a quick search, look for the opioid abuse and risk to teenagers just for one time. Now, let's talk about this VA, though, and what's going on. Of course, you're well aware, TriWest has taken over the whole U.S. for the VA Choice and PC3 programs. There was a time the company HealthNet was there, and you notice I put a circle through HealthNet. They were taken out last September, and then slowly TriWest was the one that began to take over for the entire area. It's worked pretty well, but there's some difficulty because, of course, it's such a big country. Having one company handle everything has made it a little bit difficult to deal with. So they're going to begin changing in June. And in June, in areas 1, 2, and 3, you're now going to have a new company that takes over. Now, this doesn't take away areas 4, 5, and 6 will still use TriWest. But regions 1, 2, and 3 will be taken over through the company Optim Health through Veterans Affairs. So you notice here, I'm going to just blow this up a bit so you can see what regions this entices. These regions, of course, region 1 are going to be basically the whole eastern seaboard. Region 2 is kind of the Midwest, upper Midwest, if you will. And then the region 3 is kind of the south and mid-south Midwest, I guess, if you would say. But do take a look that these are where you'll begin to see the changes. This is going to begin in June. Some of you may already receive information on this for this takeover. So just be aware, beginning June, Optim Health will oversee areas 1, 2, and 3. So that means everything goes through Optim Health. This does not change the program. The program will remain the same. It's still VA Choice or the so-called PC3, but it's going to be managed through a new company. So my suggestion, get in contact and take a look at these websites. You'll see the provider manual here. Notice info@vacommunitycare.com. Go to that website, look for the updates. They have there all the information about the changes coming, the areas. But again, it's not until June, but I suggest be prepared so that you're well aware of what's going on for your area to make a smooth transition and see for any enrollment. If any of you are enrolled already into Optim Health, this should automatically put you into this portion of the program. However, verify that you will be listed as part of it. The benefits and eligibility will remain the same. You'll see here how the veteran is to get the services. It still does the same thing. It's going to require a direct authorization. So you will still need an authorization directly from the carrier, just like we've had in the past, but it's just going to be taken over by a new company, Optim Health, but only for areas 1, 2, and 3. Areas 4, 5, and 6, which are essentially the Southwest and the Western region, will still remain with TriWest. So claims and provider reimbursement will essentially stay the same. And again, a good place to always look what the reimbursement is. Go to fairhealthconsumer.org. That'll give you a good reasonable fee for the area, but they also often have a specific fee. Go to the TriWest site and look up your code for your region, and it'll tell you the allowed amount. The big deal here is the VA choice is going to continue. It will continue allowing acupuncture, and it's going to be a great benefit to the patients who really need the care as an alternative or a complement to what they're already getting. We're finding some very good responses, but I do want to make you aware of something that is changing also, though, or has changed, and that is the authorizations. The authorizations still come through, as you'll see here, patient-centered community care, and that's just direct access. They'll have a card. Veterans Choice is where the patient lives more than 40 miles from a facility or a provider, so they get a choice of where to go. The key issue is make sure you're on the list, so when the patient requests care, if they bring your name into the equation, they'll know to refer to you. Now, I do want to keep clear, though, that all care here has to be authorized. All initial care under the Veterans Choice or PC3 requires authorization. You will literally receive an authorization via fax or email, or you'll have to go online to view it, but they will have called you to say, are you taking patients now? And then they'll set up an appointment. What is really different beyond that, because I'm sure many are used to that, is the episode of care they're authorizing. So this episode of care, you'll notice here, highlights, they're going to give 90 days for 10 visits, not to exceed 2 visits per week. That can be changed and you can request more, but that's essentially what they're going to allow. And you'll notice they give 2 things here. It says initial outpatient evaluation, so 1 exam, and then 9 visits for acupuncture. Actually, it's 10 because you can do the first visit with acupuncture as well. You'll notice the big difference here. They used to always give 10 re-exams or 10 E&M codes, and that was likely overused by the profession, so they've now made it clear you get 1 exam, not 9 exams. So don't bill exams daily, bill for the treatment. They allow up to the treatment you need to do for the patient, and it had traditionally allowed as many sets as necessary. But I want to show you what's been happening now, the latter part of 2018, now the 2019. This is an authorization, and you'll see here it says acupuncture initial SEOC standard episode of care 1.03. And you'll notice here it says the duration is for 90 days and for 10 visits. Do notice it does not say 2 visits per week. But then notice in this office sent it to me and they drew a line. Notice this one's getting 24 visits. So you're going to get authorizations that often can be more for 10, but 10 is always the starting point. But that's not really the biggest difference. You'll notice in number 2, and I highlighted it in yellow, it says a maximum of 1 additional unit of acupuncture with or without electric stim when reinsertion of needles is supported in the documentation. So what is this stating? They're allowing a maximum of 2 sets. So if you do more than 2 sets, that's going to be on you, meaning they're not going to cover it, they're not going to pay it, and the patient can't be charged for it either. So be very mindful of your authorizations. I'm noticing more and more now coming with this limitation of 1 initial set and 1 follow-up set. So 2 maximum. But notice what they pay for, and I highlighted that in yellow as well. Notice it says objective measures demonstrating the extent of meaningful clinical improvement to date. Please make sure you have objective measures. Go back, I've done a past one on this on using good pain scales and outcome assessment tools, but realize that you will be allowed to get more care, hence why this person gets 24. When you can show it, just makes them better. That's really the end of the day. Is the patient getting better, feeling better, but functionally better? But again, I want to highlight here the limitation stating, again, just 2 sets now. Here's another example, very similar, and you'll notice I highlighted in red, 10 visits, and notice it highlights again, a maximum of 1 additional unit of acupuncture. So bottom line is be very careful, read these SEOCs or these authorizations to know what are they allowing. If it doesn't have a restriction, of course, you can do as many as necessary, but I am finding more and more they're only allowing 2. Something else to bear in mind though, and I highlighted in a different yellow here, it says acupuncture visits noted in number 2 can include manual therapy and therapeutic exercise. So they're indicating you can do manual therapy, therapeutic exercise, but notice it also indicates, but not limited to, cupping, myofascial release, and therapeutic exercises. So meaning some tissue work along with therapeutic exercise. But I want to highlight specifically here the cupping. So one thing we're noticing, and I had a few VAs, they are allowing for the VA only to use the code 97016 for cupping. That code is for a vasopneumatic device. It doesn't actually quite fit what is technically a vasopneumatic device, but under the VA, they're allowing it. So for cupping to the VA, you would code 97016 for cupping. However, what if it's not the VA? How do you code cupping and moxibustion? I use two examples here. Here's Michael Phelps from the Olympics, obviously make cupping very popular because, of course, it can help with recovery. And another one here with the moxibustion. So how would I code it? How do I bill for it? Again, VA 97016 acceptable. But what about for other insurances? Because we are noticing some plans, particularly under Anthem, that are covering. So both codes, cupping and moxibustion, and you'll see it indicates on both, they have no specific code for the service. But there is a code. The code is 97039 or 97139. And what these codes are for is called an unlisted modality or procedure. In other words, it's a code for something that doesn't have a code. So these would be the codes you would use to indicate cupping or moxa, but you have to indicate on the claim form, meaning the 1500, that you've done cupping or moxa. So here's a nice simple example. Notice on the date of service, it shows, there we go, I'm gonna enlarge that a bit. It shows the date, and then notice on line number 2, it says cupping in the pink shaded area to indicate for this service we're indicating cupping. Notice on the next line it indicates moxibustion. That is what that little shaded line is for when you use an unlisted code like 97139 or 97039. I'm not sure one is better than the other. They both are acceptable. They're unlisted. 97139 indicates more hands-on, whereas 97039 doesn't. Either would be acceptable. And you simply put your price. So to code cupping and moxa to insurance, not VA, to insurance, do this simple thing. Put 97139 or 97039. In the pink shaded line above it, go right in and type in cupping or moxibustion. And we are finding some plans that are covering. Now, let's not get too excited. I'm literally finding the coverage to be anywhere from $10 to about $20, but it's better than zero. The good news is they're beginning to recognize the efficacy and also making payment. An insurance company won't know that an acupuncture provider is providing cupping or moxa unless we're billing for it. And I'm going to encourage all providers, begin coding for cupping and moxa. And the reason you want to is that way they can see it's being provided and is necessary. So if you're providing those services, please do code for them, charge a reasonable price. I put 25, but if you're charging 10 or 15, whatever you're charging the patient is simply charged. Yeah, VA Choice and PC3, beginning June for areas 1, 2, and 3, is going to be taken over by Optim Health, VA Community Care. The other regions, 4, 5, and 6, will remain with TriWest. The protocols for reimbursement will remain the same. You're just going to send it to a new area and get different authorizations. Also for cupping and moxibustion, they can be coded. For the VA, you can use 97016 for cupping. For non-VA claims, use 97039 or 97139. As always, we're here to help. Please take a moment. If you have a question or have an inquiry, come and take a look. We are always available to you on our pages. Go there, and we always have once a week at least a question and answer on our Facebook page that allows you to go in and see what's the question answer about a diagnosis code or billing code. We're always here for you. Definitely go to our website. It's aacinfonetwork.com, and we're here for you as American Acupuncture Council always is. Thank you for the time, and we'll see you on the next visit.